By Richard Muganzi, the Director of Programs at the Center for Health, Human Rights and Development, who believes that the idea is not well conceived. Good afternoon, Richard. Thank you for joining us.
Yes, good afternoon to you.
What is your concern, Mr. Richard Muganzi?
Yes, the concern is that actually when it comes to diseases like HIV, TB, and other communicable diseases like malaria, it is important that anyone who, especially those whose liberties have been restricted, are accorded the same level of treatment and duty of care in health service provision as it is done for all others in the general community. So if you subject different measures on people who are under detention or who are likely to be detained, then the principles of equivalence of care under international law, under our constitution and various legislation are going to be violated. It means, therefore, that for us, where I work, the Center for Health, Human Rights and Development, we consider that several abuses are likely to happen. Health might most likely be used as an instrument of control and punishment rather than according care to these people. So it abuses their human dignity, it abuses their privacy, it requires them to consent. It has to be voluntary. So you cannot unequivocally come and subject someone prior to their detention to such measures without particular safeguards. And it is very likely, therefore, that it is going to instill fear, stigma, present such situations where equality before the law is also going to be compromised.
And again, what do you think should be done from your perspective?
It is important that, first of all, if anything of that nature is going to be done, it should be guided by clear policy and law. Parliament should come and scrutinize and see what is it really that has to be the framework to be followed and doesn't be abused. If data is to be generated, that data be only to help the individuals who are owed the duty of care. If it is to be done, let health service providers, professionals be used, and let also the police be trained on non-coercive measures of helping these people than using the data as a tool. And probably also we could say that the monitoring institutions like Parliament, Uganda Human Rights Commission should always ensure that in places of detention, these principles are always upheld.
All right. Thank you very much, Mr. Richard Muganzi, for your time this afternoon.
Thank you too.
And as we now move on, TikTok has been charged with breaching EU online content rules over what the blog's regulators said were its addictive features and was told to change the design of its or risk a fine as